Welcome to the case presentation of Patrick. He is 78 years old male who has worsening of his left-sided heart failure and has chronic obstructive pulmonary disease. He was a long-term smoker for almost 40 years and has a history of myocardial infarction to a branch of his left coronary artery at age 68. Currently he is having regular cough and dyspnea and looks tired. Also his lower limbs are swollen. His vital signs are within normal range except pulse rate which is 155 beat per minute. There are some contributing factors for his respiratory symptoms of coughing and dyspnea. Firstly, his long-term smoking has led in reduction of lung function to filter harmful chemicals. Due to unable to filter those chemicals, toxins get trapped in lungs which lead to inflammation of lungs and airways, consequently resulting in respiratory symptoms and difficulties. Another contributing factor is age. There are some physiological changes in lungs as the person becomes older, such as air sacs becoming baggy. This change decreases exchange of gases, resulting in difficulty in breathing. Patrick has higher heart rate than normal. There are some factors responsible for Patrick's heart condition. Firstly, cigarette smoking. It constricts the veins and arteries due to nicotine, which is chemical present in cigarette. Secondly, overweight, as body demand more oxygen into muscles for metabolism. Thirdly, his left-sided heart failure, as pumping of oxygenated blood is reduced throughout the body. These all factors make heart work harder than usual to pump blood, which consequently increases heart rate. Regarding his chronic obstructive pulmonary disease and left-sided heart failure, his long-term history of smoking and his advanced age plays a vital role to contribute this condition. Being a chronic smoker, it brings inflammatory changes in lungs and airways. However, some physiological changes comes with age. For example, baggy air sacs. This situation might be the cause of developing COPD. Moreover, due to COPD, oxygen level is decreased in blood, which might alter the normal function of heart. As a result, may end up with heart failure. On the other hand, Patrick had a history of myocardial infarction to his left-sided heart affecting left coronary artery, and this may have led to decrease in blood supply resulting in left-sided heart failure. Therefore, his disease condition can be interrelated to each other or independent in certain circumstances. Due to his current condition, Patrick is at the risk of developing right-sided heart failure too. His left-sided heart failure caused the blood to flow back through the lungs, causing pulmonary hypertension, which lead to right heart hypertrophy, causing right-sided heart failure. Is another condition which is COPD. There is inflammatory changes in pulmonary vasculature developing pulmonary pressure. Pulmonary pressure is a type of high blood pressure that affects arteries in the lungs and in the heart. This condition causes right-sided heart hypertrophy to compensate pulmonary pressure, resulting in right-sided heart failure. Seeing his condition, blood tests were done and results were quite abnormal. Sodium level is seen high in his blood. Due to his condition, there is decrease in cardiac output and renal perfusion, leading to renal angiotensin-aldosterone system, known as RAS activation. It results in sodium and water retention, causing increase in sodium level. His potassium level is high. It can be due to the drug used for his heart condition such as ACE inhibitor, which increases potassium absorption. His calcium level is low. It can also be due to the use of medicine for his cardiac condition such as loop diuretics, which increases calcium excretion and there is less calcium concentration in blood. Moreover, his hemoglobin level is also seen low. It might be because of his heart condition. There is decrease in cardiac output leading to renal vasoconstriction and ischemia. This results in decreased erythropoietin synthesis and function leading to anemia, which can be the cause of his low hemoglobin level. Furthermore, there is increase in LDL, triglyceride and glucose level, whereas decrease in HDL level. It may be due to his overweight and uncontrolled diet. This imbalance in electrolytes and other blood test result does not only affect physiological health but also impact in neurological function. Due to his altered blood test results, the patient may develop different neurological conditions, including confusion, hyperreflexia, seizure, or a stage of coma. Beside all those investigations, there is one additional blood test which can be done and is likely to be abnormal. That is blood pH. It is expected to have decreased blood pH level in Patrick's condition. As due to his condition, there is decrease in lung ability to excrete carbon dioxide level, thus resulting in respiratory acidosis. Thank you for listening.